like
From
people,
Joe Rogan podcasts everywhere.
people, it's one thing if a doctor says something about themselves, but when you get a lot of people, you know, talking about their experiences, then that kind of weight of evidence really makes a difference.
And it's not
So.
placebo. It's not. I've had so many people say, is it placebo? Maybe for some it is, and for me it's not. You feel it as just like Dakota said. As it's going, you kind of float down, and as you pull that needle out, it's like you already know it worked. It's hard to explain.
Yeah, and so
It's
what I do is,
shaken, it's very emotional.
yeah, because I'm a researcher, like I trust nothing,
Mm-hmm.
right? Because I'm always careful to not let my own biases
Right.
like
'Cause you want it to
change
work.
things, right? Because
Mm-hmm.
well, if I want it to work, that might mean I only see what I want to see.
Right.
We all have something called confirmation bias.
Mm-hmm.
That's why people that watch Fox News just watch Fox News, and people that watch CNN only watch CNN.
I'm
You know,
majored in psychology, I know what you're talking about.
so I mean, we all look for what we want to see. As a researcher, you have to be on guard for that.
Totally.
So, although of course, every doctor wants their patients to do well. But what we do is I've published 10 papers now in the peer-reviewed medical literature. We just published another one just a couple days ago on left-sided Stellate Ganglion Block. So
Got
we did.
notice that it was on there. I go to the scholarly google.com. A lot of people don't know that exists.
So in June we published the first paper on 2-level blocks, and last week we published the first paper in the peer-reviewed literature on left-sided blocks. So it continues to evolve. We continue to learn more. And here's some things that one of the things that's kind of working that we're seeing is that as we treat people and people like you that have had long-term trauma, what happens is long-term, like dealing with trauma.
Right.
What happens is that the parts of the central autonomic network, the parts of the brain that control that fight or flight response or the parasympathetic response, they actually can change physically in size.
Right.
And then the connections between those parts of the brain can physically change, like in the size of the pipe that goes between them. The size of the strength of the connection between these different parts of the brain changes due to neuroplasticity. So the brain is changing in response to things that it sees, especially like chronic stressors.
Right.
And so as we treat people and as people live their lives, their brain is changing. Mm-hmm. And so that's why we score every block, because we want to know, did we get a good sympathetic blockade? And the eye is just the external gauge of that.
The Horner syndrome.
Yeah, that's like the first kind of thing that we look at. Did we get a good block? Okay. And then, which I think is getting time to score your block. But then we follow up, how did they do a week and a month, and longer.
Right. And I was so happy y'all called and checked on me even quite a ways later, and I thought that was very nice and thorough.
So just rest your gaze on the line notes and just let your eyes be relaxed. And then do the same to Nancy.
You want to come get a visual of my eyes?
222.
You're having a great block. This is 5 minutes after. Oh, sorry.
I'm sorry.
You're good.
Okay. You can go ahead and lay back now. We want to keep that anesthetic in that plane. And then...
Should I lay back when I get home too?
No, well, you can if you want, but it's not
necessary.
It's not important. So, would you like a glass of water or anything? Are you warm enough? So really what I like now is
very calm and happy right now.
So where do you keep your tension in your body? Like in your shoulders, neck, stomach?
Mine is very, here lately, it's my back so bad that my shoulder raises. I feel like I'm having anxiety to have like something squeezing me.
Okay.
And I'll vomit.
How do you feel now? How does your abdomen feel now?
I feel calm from head to toe.
So your abdomen's relaxed.
My toes are even tingling, I'm so calm. Like they're waking up.
And your shoulder, it looks like it's laying down.
They're laying down flat. I feel myself sinking, that's what I mean.
Okay, and
You literally go.
People talk about that melting into the bed feeling. And
so
then
relaxed.
you feel calm.
Yes.
So what I look for, what I just comment on is after we see how the Horner's is, then usually, I mean, you're having it now, usually we wait 10, 15 minutes to kind of let the reset happen, but this is already getting going on you. what we look for is something in the mind, so calmness is feeling relaxed, and then something in the body, like most people usually have a tell, someplace they keep their tension.
That's
Shoulders.
why
I
I
have
can
some
tell.
people like they're like, I keep my tension in my feet.
My
And
toes
it's
are
like,
tingling right now.
like all over the body. It's common, like abdomen, chest. My chest feels tight. So you hear all these, but we just go in that person, where do they keep their tension, and then we look for, okay, are they relaxed? And if so, if they're relaxing and the mind is calm, that's kind of indicating that this two-way conversation between the mind and the body has been stopped,
Yes.
and they're each, the mind and the body is now calming down and not receiving any input, any of that loop input. The mind and body is now relaxing.
I was trying to explain that loop to him.
Yeah, and
It's
so
like
it's
OCD, it just goes around and around and around.
like a computer with the blue screen of death.
Yes.
There's nothing wrong with that computer. It just is stuck in a loop it can't get itself out of. You
Needs to
don't
be
throw
shut
them
off and
out.
turned back on.
Yeah, exactly. So, and that is, it's not the long-acting local anesthetic. Nobody steals. It's called ropivacaine is what I injected. Nobody steals it. All it does is stops the nerve from conducting. And in this case, we just used it to turn off your cervical sympathetic chain. It's commonly called the stellate ganglion. It's turned off.
And that's the
It's
flight or
settled.
fight.
And so, so what you're feeling now is not anything I injected. What you're feeling is the absence of anxiety,
Anxiety. Right.
which is crazy.
And don't be misunderstood. Like I'll shake when I start getting calm because my body doesn't know how to relax because it's that way all the time, 24/7. Doesn't matter. And when I do start to relax, I'll shake. It shakes, and then it'll slowly just slow down, and then it's like a slow and then I just sit.
Yeah.
It's really weird, and it's because I'm always this way all the time. So it's my body fighting, trying not to calm. But it's not me doing it; just does it.
Yeah. And then a lot of people worry, am I gonna think about something and wreck this?
Right.
No.
No.
Just like the light doesn't get to vote when you turn off the switch.
Right.
It's just off.
It's just
So you can just, you don't have anything to worry about.
right.
You just, what I try to get people to do is like slow deep breathing, like 4 or 5 seconds in, pause, 4 or 5 seconds out. And even if you do that like for a couple, like 2 or 3 minutes a couple times a day, because your autonomic nervous system is breathing is under the purview of it. That's why we don't die when we go to sleep. We keep breathing without thinking about it.
Right.
But we can take control of that breathing, and that's a way to help outwardly calm that sympathetic nervous
We
system.
thought about meditation and starting to do that.
Those things are very positive, and there's a reason why these are like these even like martial arts or meditation or
Kind of ground
They're-
or cheese, so to speak.
many of these long-lasting traditions all involve controlling the breath for a very practical reason, because it's a great way, because when it calms the body, it's also calming the mind.
Right.
And
I've been
so
trying
it's
to
a
do
nice
monk
way to kind
things
of-
too, the same way that meditation, like they think of something bright, pretty, try to just clear the mind of anything negative, and
Yeah, but
because
a
mind
lot of times
talks
that's
constantly.
and how about now? Is it a busy place now in your mind? Yeah.
And I hear voices constantly, but I don't know.
Yeah, so a lot of people, their mind feels like very scattered and busy all the time,
Right.
and after this, it feels very quiet.
It's almost scary for me. It's so quiet. I'm like,
Because
something
you've
wrong.
had it since childhood,
childhood.
right? So I mean, it feels foreign,
Foreign,
but it's
but it feels so good.
good. And then what we do is we just, hopefully what happens is these things will space out, and and at some point, as you sleep better and as this stuff happens, I anticipate that we get to a point where you don't need this anymore. Some people are one and done, but I anticipate you getting to the point where as your resiliency builds, the same things that might have triggered you won't have the power to trigger you anymore.
Some of those things have already went away from the past treatments.
Yeah, so
And this is new. This is a new experience. I've never experienced something like that. And it was full-fledged, like I wasn't there. Like I literally saw a child's body, like my child body.
So
So it's new is what I'm trying to explain to you. I'm not trying to, go into it. I'm just trying to explain that's what it was. And when it hit, and I'm crying every day for 4 days, uncontrollably. I mean, 4 months, 4 months, every day.
Well, we don't want that.
You can ask him, it's bad.
Hopefully you
I
come
have
back
bruises
before
on
that.
me, I have scars everywhere, I put my butt back through a wall rocking. So this
Well,
feels amazing, and I appreciate it so much.
Try not to let it get that bad for that long. You know, we're all gonna have bad
We were
days
trying
from
to
time
get
to
here.
time.
We're trying to get here.
I mean, you guys can call and just say, if somebody's really having that bad of a time, I'll get you in as soon as you can get here. I'll see you over lunch, I'll see you before or after clinic. If someone's in a bad way like that, I'll just get them in.
Because I really did put myself through the wall, like through the sheetrock.
I don't want you doing that.
Okay. You know, it's important for people to know. I want them to know they're not alone. Because it scares me to death. I think, am I going to live? Am I going to die? You know, it scares me. And it scares a lot of people.
You know
This
that
helps so
you know
much.
this is helping you, so
It's saving my life.
don't go dark. Don't go dark. And if things get sideways,
Just
we'll
call you.
figure out how to get you in immediately. So don't worry about it.
Appreciate
I'm gonna let you kind of just have a little reset time.
that. I
And
appreciate it so much.
no, I'm happy to do it. You know I am. So I'll be in to check on you, okay?
Okay, thank
Do you
you.
need anything?
No, thank you.